Good afternoon and welcome to United TV. Today is Friday, April 11th, 2025. It is our Bariatric Friday, and we are going to discuss another topic. And not every topic is easy to discuss, and this is one of those that makes it a little bit difficult in a couple different ways, and then we are going to find out why. Today, our topic is going to be social stigma and sexual well-being and sexual health. And Dr. Irgau is going to join me as always. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Glad to be back on yet another wonderful session of Bariatric Friday.
It's good to have you.
Thank you.
So, the being in healthcare and dealing with a group of chronic illnesses which are not really understood by everyone at the same level, like if morbid obesity versus diabetes versus chronic kidney failure versus hypertension, these would be equally same level if anyone asks you or me. But anyone, if you just go to the Christiana Mall right now and then ask people, they're going to say, morbid obesity, this is lifestyle choices. So we are trying to prep our patients go through this process. This process is getting them ready for their surgery, but not only pre-surgery, but also post-surgery, we're trying to prep them for their new life. Now, we see social stigma being one of the biggest issues that they deal with. Some patients, they don't even want to talk about. And that's why we bring up this issue in our sessions so that we can actually be their voice and we can address some of these issues. Now, you see a lot of patients day to day. You operate on a lot of people. My question is the societal attitudes towards obesity impact on our patients before and after surgery. How do you see that, or at what level we have that impact?
Well, I mean, clearly it is there, Kemal. As you correctly said in your introduction, society views obesity really through a very, very critical and often judgmental lens, right? And that really has an impact because it results in stigmatization and, of course, discrimination as well. And that is pervasive. It is not really something that you find only in one aspect of life. It's really pervasive. It could be the workplace. It could be the school for children and young adults. It could be any other setting where people are looking at each other and making judgments about each other for various reasons. So obesity sticks out as a negative connotation, right? And that stigmatization and discrimination does have consequences on the mental health of people who are struggling with obesity in two ways. One is because obviously they are not succeeding in getting ahead like everybody else in society because they are finding this stigmatization an obstacle and a challenge for them. Secondly, they themselves end up believing what the society is projecting on them, and that is that it is their fault that they are struggling with obesity. And therefore, because it's their fault, it is them who have to be blamed, and therefore they are the ones who are weak. They are the ones who are not good enough to overcome this problem, right? This is really something that comes up time and time again in consultations with patients. Just today, I had office hours, and I met a young woman who was telling me sincerely that she really doesn't eat a lot compared to other people, her peers or her family. She really exercises, but she doesn't understand why she cannot lose weight. And this has been the story of her life. She's been tortured by this process. The key here is to understand that there is a biology, a pathophysiology, as we call it, that drives obesity more in some people than others, right? Just like that some of us are tall and others not so tall, driven by a particular set of genetic characteristics, so does our physiology, our metabolism. Sure, yes, the environment does have an impact on this. There's no question that if you moved from the United States, a very highly technologically advanced society where we rely so much on gadgets to do things for us, if you move to a village in Africa, you wouldn't see as much obesity, although there may not be very much difference in the genetic distribution of the metabolism that causes obesity. That environment is clearly different. People eat differently and they move differently, and that has kept obesity at bay for that society. But we live in this society that is so fertile for obesity to flourish, and it's no surprise it is. But it doesn't flourish equally. It's not distributed equally on everybody.
Right.
As we all know, some people can eat whatever they want without any focus, never work out, and yet they don't struggle with weight. In fact, if they want to lose weight, they can drop 10 pounds without any problem. Others could be just drinking water most of the time and the weight doesn't go off. Or they struggle very, very hard to lose about 10 pounds, and then one day they have a nice meal and they have 5-6 pounds overnight. Which means really there is a difference in biology. And this lack of understanding that it is a disease, a pathophysiology, leads to this stigmatization. And really, this leads to a lot of suffering. Well, it's no wonder that obesity is associated with depression, with anxiety, to a very large extent.
But how do you cope with this?
Well, it is difficult.
Patient who's going through this, they are already making a lot of difficult decisions. What's the coping mechanism?
So, let's see, for instance, right? We are doing every week a session on bariatric surgery, right? We're trying to educate people, right? And just like us, there are others who do the same. There is much more awareness now about the dangers of obesity as a disease, the complications of obesity, right? And yet, what is the percentage of people who actually come out of their shell seeking help, Kemal? A very small percentage. You don't see that disparity when it comes to other illnesses like cancer, diabetes, or hypertension. People would jump out of their bed and go to the doctor as soon as they find out that they have a disease. Not so for obesity. And why? Because people feel they victimize themselves, really, because they don't have a good understanding of why they're struggling so much.
And sometimes we just wait.
Yeah, you just wait. But as you wait, it doesn't get better. That's the other thing that people don't understand is obesity is by itself a platform for more obesity. In other words, once you reach a body mass index, let's say, of 40, Kemal, it's very easy for you to go to 45.
Right.
Very easy for you to go to 50.
It's like our YouTube subscribers. Once we hit 100,000,
that's right.
It's easier to get the 110.
Absolutely,
right?
absolutely.
So that's very true.
The more obese a person is, the harder it is for them to come down, but also a lot easier for them to go up. So the more they wait, so how do they cope with this, Kemal? It is very difficult. It is really a struggle that no human being can cope by themselves unless they have good support. That's why it's very important for us to continue to do this and to reach out and to let people know, yes, there is help. Yes, you can come out of this. Of course, you need to be committed as well. You need to make some changes. That is critical, but that is not the key to getting out of this. You need a powerful tool. Right. Whether that tool is the support that we provide, the surgery or medications, that tool is absolutely necessary. And that tool is a medical intervention. The only reason you give medical intervention, Kemal, is if there is a disease. You don't give medical intervention if there isn't. That's why we have bariatric surgery. That's why drug companies are developing medications, because we've recognized it's an illness.
But people are, the society is different. Society is cruel. So for someone who may want to get a plastic surgery, they may support that person. Hey, this is good for your self-esteem. Right?
Absolutely.
But same society, when someone is trying to go through the bariatric surgery for their morbid obesity, they're like, oh, you go with the easy way out.
Absolutely.
So if you look at number of plastic surgeries that's being performed in this country, that's probably more than the bariatric surgeries.
Oh, absolutely.
Right?
Absolutely.
So
absolutely.
no one is saying you don't see anything in social media, in other places. related to these. No one is making fun of them.
Mm-hmm.
I mean, there may be some, but not at the level that they are making.
Absolutely. Absolutely.
So now in this episode, we actually we talk about different topics in every week. So with the social stigma, last time when I covered this topic, I focused on social stigma and the sexual well-being on the woman's side, and Dr. Gail Wynn was with me to kind of emphasize the issues on the woman's health and woman's sexual well-being. Now, obesity has impact on puberty, right? Obesity has impact on male sexual health, erectile dysfunction, reproductive functions, prostate is related to obesity, and yet no one actually talked about those.
Absolutely.
So they may be talking in small circles, but when it's in these types of platforms, we don't hear people talking about early puberty and what that means for that individual, what that person's life is going to be in the future, what that person is going through with their friends and schoolmates.
Absolutely.
So, and then we have the sexual health part, which actually, one of my old notes. So again, not actually taking it taking a different direction from the topic, but social stigma comes with the sexual behavior. But then what sexual health is important for people is lowering blood pressure, better immune system, lower heart disease, improve self-esteem, decrease depression, increase libido, pain relief, and better sleep. So these are, it's almost like a magical pill that you are taking, but that's actually not the pill, but that's the sex itself. Now, why am I talking about this is because many of these individuals who are fighting morbid obesity are not necessarily able to have the same opportunity with their, even if they have a sexual partners, they're not able to perform a sexual act. So now the obesity and direct impact on the sexual health and intimacy, can we talk about that a little bit?
Of course, you touched upon some of these very important topics. First of all, clearly there are some obesity-related organic dysfunctions that directly affect sexual health, right? And of course, there is the bigger issue of psychological impact, of lack of self-esteem that comes with obesity and its impact on one's sexual health, right? So as you correctly said, for instance, obesity is related with erectile dysfunction, right? Which is a major issue. It is a little bit more complex because obesity itself also affects other organ systems that have an impact on erectile dysfunction. For instance, circulation, which can be affected by high blood pressure, which can be affected by diabetes. Two conditions that are by themselves complications of obesity can lead to erectile dysfunction, right? So that's one major organic issue. And in women, as you correctly said, the accumulation of excess fat can also lead to hormonal derangements that will have a direct impact on desire, on libido, but also other aspects of sexual health. As you mentioned, for instance, in menopause, you have changes related to decreased estrogen that can lead to problems like dryness and loss of desire that come also when obesity is related to menopause as well, right? So these are clearly organic problems that obesity is directly impacting on the sexual health of the person. But then the bigger issue also is that, sexual health is about relationship, Kemal. Right. There's no sexual health without good relationships. But how do you have good relationships if self-esteem is impacted, right? If judgment comes across, right? I mean, there was a study some time ago among college students, right? This was one of the social study questionnaire studies where they asked the college students about potential partners. And they told them, would they marry a criminal or somebody who's obese? And the vast majority of the college students says they would rather marry a criminal than an obese person. Just look at that, a criminal, somebody that could potentially ruin their life and hurt them.
Luigi Mangione kind of increase the expectation on criminals.
There you are. So what I'm trying to say is that it's a non-starter for somebody who is struggling with obesity when society is primed in such a way, right? Even studies of children as young as kindergarten kids, they were shown pictures of kids that were overweight and kids that were normal weight. And the kids were asked to associate each picture with certain characteristics that they were receiving. For instance, intelligent, smart, lazy, bad. Okay? The vast majority of the negative connotations, they were associating them with the pictures of the kids that were overweight. These are kindergarten kids. And the vast majority of the positive attributes they were pushing them towards the kids that looked normal weight, which means that at that age, we are primed to look at obese people in a negative way, right? So if sexual health is really based on relationships, and if you're starting with that type of lowered self-esteem because society is loading all that negative garbage on you, it is very difficult to be confident and enjoy a relationship, right? Not to mention the fact that you will have also physiological problems like erectile dysfunction or decreased desire, decreased libido, which are directly associated with obesity as well. So it is no surprise to me that obesity is associated with sexual dysfunction as well, right? It is no surprise to me, Kemal, that when I asked patients, for instance, right, our patients who are coming for bariatric surgery, right, and this could be, for instance, women in their 30s, right? In their 30s, prime of their sexual health, right? Come on. I would ask them, okay, we have to make sure that before surgery that you're not pregnant. That's a question we ask them, right? At the surgery center, we do a pregnancy test. Yeah. And many women would say, oh, no, I know I'm not. And then I say, okay, then, are you taking precautions? And they would say, oh, I haven't been with anybody for so many years.
That is correct, yeah.
That is sad when you hear that, Kemal. And you see in their faces that the reason is not intentional. The reason is because obesity is affecting negatively their self-esteem, right? That side of their life is being shut off completely, right? No wonder anxiety and depression are pervasive as well. So yes, obesity does affect sexual health as well, and it is something that we should talk about more, but we don't for a number of reasons. And one of the reasons may be, Kemal, because obesity, again, is one of the last items in society upon which discrimination is allowed even in an open setting without any problem.
Well, I mean, I want to put some statistics there. Obesity and morbid obesity increases the risk of erectile dysfunction by 90%. So, and we know how important that is for men, and this is 90%.
Yeah.
So, and everything else that comes with it is pretty much driving you directly to depression. The sperm count is another problem where there's a decrease of sperm count, which actually this is where I was saying about the reproductive chance of working on the other side. It's impacting. So yet we still see this as a huge problem. Even like the other day, I was watching something. Like social media is a huge trash dumpster. I think we have some of the videos or maybe pictures that's going to be. There's some of them are unfortunate. Yet we probably don't know. It's almost like seeing a homeless person. Like I asked John Carney the other day, what do we do when we see a homeless person? Do we approach them? Now, let's see if this analogy works. And then, like, trying this on a live, kind of risky, but you can rescue me if it's not if it's not working. So he said, no, you don't approach them unless they do something illegal. But we see on an airplane this obnoxious person going and approaching the person who's overweight because they didn't buy the second seat. So what do we do in those situations? I mean, this didn't happen to us. I mean, you and I, we travel. I mean, it hasn't been done. We haven't gone anywhere for a while, but we used to. We haven't seen these situations, but I see them on social media all the time.
Yeah,
so what should be the course of action when someone sees those types of situations, like when two people are already in that conflict?
Absolutely. I mean, unfortunately, as you said, even the actual social media portrayal is actually blaming the person who's overweight when they bring that out, right? They are blaming them, saying, okay, well, then don't get on the airplane, or you have to find the funds to buy ticket, or don't travel. So that person is being castigated for that, right? Instead of saying, you know, airline people come in different shapes and forms, right? Accommodate them. That's what you have to do, right? Now, as a society, by saying that, we're not promoting obesity as such. This is an important distinction that people need to make. We're not saying it's okay to be obese. What we're saying is obesity is a condition that is out of control to a great extent from the individual, right? If it is, help is needed. We have to look at it as a medical problem. Right? If somebody goes to an airplane, Kemal, and they say, I have to take this particular device because it helps my heart or it helps my blood sugar.
Everyone would be helping that person.
Everyone would be helping. Everyone would be helping. And the people who work in the airplane would say, okay, what else can we do to help you? But because, that is triggering that compassionate side of people. And that's what's lacking. When it comes to obesity, there is no compassion. There is blame. There is judgment. There is stigmatization. And we need to get out of that, right? But the problem, again, is even as members of society, we're lacking education. That is our problem. We're assuming that obesity is all about eating and exercise. Does eating and exercise have a role in it? Of course, but it's not the whole story. That's not the whole story. That is what people need to understand. Look, if you have a population in a certain district of a city or a village somewhere, and you have a factory or a mine around there that is producing certain fumes or smokes that are causing a higher level of asthma in that population, you don't go and blame the asthmatic kids and say, it's your fault that you're asthmatic. No. Well, they have a higher risk for asthma and the environmental situation is worsening, right?
They blame the parents.
Right, that's right. Now, if you can remove that trigger, it's the best thing you could do, right? Well, society is not doing enough to change our setup so that obesity prevention is enhanced, right? Come on. Look at the United States, come on. How many roads have walking paths, right? Not very many, right? Go to places like Newark, which is like a suburb type of places, like Christiana Hospital. Yeah. Well, just look at near Christiana Hospital with all the highways.
You won't be able to walk.
You won't.
Because you won't be able to pass the...
You won't. Yeah. You won't. I told you the story of my story, like many, many years ago when I came for an interview for my residency in Christiana. And I stayed at one of the hotels across, and I tried to walk to go from there to Christiana Hospital, and I could have gotten myself killed because there are no walking paths, essentially. So the point here is that if society wants to do something about it, there are things we can do, right? Increase the ability for people to do things, to walk, to run, to be active, and also try to look at the food industry and the garbage that they are putting on the shelves of our supermarkets, right? And that has an impact. Now you could say, well, people have a choice and they could buy this and buy that. Well, not so fast, because the things that are healthy are actually more expensive and less accessible. And they're not there readily, right? So as a society, yes, there is a lot we can do. But the last thing we should do is blame the victims.
Think about it this way, like the single mother with 2 kids.
Mm-hmm.
What is she feeding the kids with?
Mm-hmm. Mm-hmm.
I'm not blaming the mother.
Right.
The financial limitations,
Absolutely.
she's probably ordering pizza for
Absolutely.
them.
Absolutely.
What does that do?
Absolutely.
Right? So
absolutely.
now, the well-defined understanding of social stigma is important. So, like what we say in this is that any discriminatory acts, ideologies targeted towards individuals because of their weight and size.
Mm-hmm.
So now, I even see it in like TV shows.
Mm-hmm.
Now, not as much as with our American shows, but a lot of Turkish shows, they still call people fat on TV, like in the TV show itself. I'm like, I don't think we do that anymore here.
No, I mean it
You think we do
it
that?
is much
No,
less acceptable here now than it used to be. But clearly, in many countries, it is still a completely acceptable
Right.
form of discrimination and stigmatization.
So our goal is to say, look, this is not because people are lazy or irresponsible, not because of their choices. There's a clinical part of this. Now, again, when you say it, when I'm listening, some of the discussions that we have and today with how important this same body as we age, it's responding differently.
Totally.
Today, all I had is one robot product. So what time is it? Almost 4. Okay, didn't eat anything. In the old days, in order to maintain my weight, I probably would just have a regular meal and wouldn't have any. Wouldn't have to worry about it. 10 years ago. I mean, check some of my pictures from 10 years ago. I wasn't doing anything special.
Different. Yeah.
But today I have to maintain.
Yes.
So that means my biology is changing with age.
Absolutely.
So
Absolutely.
not understanding this is it's almost if you don't want to hear the reality, fine. So that's not our goal. We're not going to be able to change those people's mind, but we want to make sure that we can provide the education for those who are actually looking reasonable understanding of what certain things are happening, why certain things are happening. Just like type 1 diabetes. So this has nothing to do with controlling anymore, right?
Totally.
So the little kid have type 1 diabetes. Why? Because their biology is that way.
What it is,
So now, of course, how much we do, how much we eat has a lot to do, have a lot to do with how we got to that point. But we were going to get to that point. Again, I'm talking about specific, maybe group of people. Regardless of what they were doing, instead of BMI 47, maybe they were going to be BMI 44. But they were with the good diet and other things, maybe it impacted them at 3 BMI points. That's about it.
Absolutely.
So now, when we talk about different surgery types, and when we take almost more than half of the stomach on the gastric sleeve, the part that we are removing is the part that's responsible to communicate with our brain to say, hey, I'm hungry, send me stuff. And we are taking that out.
Absolutely.
So there is a biological impact that we remove that barrier, saying that, okay, this is not going to happen anymore. So that's why actually looking into the bariatric surgery. So if someone has the disadvantage that comes from biology, so that's the way to resolve this problem. But again, for people to not to be able to get that point, many of our patients, they have to get psych clearance. Why? Like you don't get a psych clearance for gastric. You don't need to get the psych clearance for gallbladder or hernia repair, right? But if it's bariatric surgery, you do. So that means that person, we already assume that person has some depression or psychological impact in their life, because this would lead that to that problem. That's why we are getting a clearance, right?
Yes.
So we don't ask this person who's going to get a nose job to have a psych clearance.
No.
Do we? No, we don't do it for the hair transplant,
Yep.
but we do for this because we already know that this has an impact.
It does.
So that's
It
why
does.
helping and supporting individuals and also not to make fun of them is going to be part of it. But again, how this is going with the sexual well-being, this for people to be healthy and happy with who they are and have a good self-esteem to deal with different issues that life brings, they need to be in a good position to start with. So this is kind of like where we are with this issue. I know we are going to get into the details later on in different sessions. Anything you would like to add before we close today?
Oh, what I would like to add, Kemal, is that if with this session, particularly in like today's session, we can bring to light the fact that we as healthcare providers, we're talking about a condition that is no different from any other condition that we treat. If we can bring that message across to people who are struggling in silence, I think we're doing a good job, right? And even if the person who's listening to this themselves are not struggling, if they have a family member, a friend who's struggling, they need to bring to their attention that there are answers, right?
Right, absolutely.
And that obesity is not just a question of appearance and convenience, right? It's a health problem that has significant complications as the years pass that are life-threatening, but also have a very negative impact on the quality of life of the person.
Absolutely, absolutely. Yeah. Well, as usual, this is providing a lot of good information for our patients and for society itself. Yeah. Thank you for coming over and
My
being
pleasure.
part of
Thank
this.
You. Thank you.
We'll be back next week with other topics. Thank you for watching us and have a great weekend. Bye-bye.
Bye. Thank you.